My name is Colleen, and I am Dr. Daftian's nurse. I have the lap band also. I was, it's been about 10 months now, and I'm down 60 pounds. I'm hoping for another 40 to go. And it's been consistently about a pound to 2 pounds a week. As a nurse, I liked that it was less invasive, that you could be back to work up on your feet in 3 to 4 days, that I would still function normally, my body would function normally, so I wouldn't have malabsorption, I wouldn't have dumping syndrome, I wouldn't have my hair would not fall out, and because it's a slower weight loss, your skin has time to pull back in, and that's why. It's because I could see the results and I could see the good things, and I liked what I was seeing. I've seen patients come. I was in clinic last week, and there was 2 patients that came in. One male, he was lost 215 pounds, and then the same day, a girl came in. She lost 145 pounds, and she was engaged, and in fact, her fiance had the lap band done. So it was kind of fun to see that here their lives, both of them changed, and here they're getting married, and so that's exciting. I decided to pursue the lap band because of what I read about it, and I was desperate. I needed something to work. I really actually kind of gave up on, I couldn't do another diet. I can't even tell you how many times I joined Weight Watchers. I mean, if they really kept record of it, it's had to be at least 40 times in the last 20 years. And I just couldn't do it anymore. Because I knew if I lost it, I would gain it again. I almost feel like I'm an evangelist for the program, because I really believe in the program, or just the lap band itself, that I want everyone to know. And it's not in my personality to go to someone on the street and say, have you tried this, or maybe you should think of this. But if anyone were to ask me, and I'm so willing. At first I was like, I don't know if I want anyone to know that I'm getting this done. It's another thing that I'm going to try. And when I decided to work for Dr. Daftian, I thought, I probably should start telling people. And I've been received very well, and I think people are just really wanting to have an answer and a hope also, for their health. Dr. Daftian, I love the way that he dealt with me and with other patients, is that he was very, not only empathetic, but he was sympathetic. He had a lap band, and he really looks at obesity as a disease process. And, I can see the results of what disease does to someone. So I can believe in that also. The lap band helps curb hunger. I also say it's forced portion control. So if you're an emotional eater, if you are a binge eater, there's only so much you can put in there. I'll give an example. One time I was having a very stressful week, and I came home and was like, that's it, I'm ordering a pizza. We're gonna have a pizza. And ordered it, it came, and I could only eat 1 piece. And it was like, oh, I can't even binge on pizza anymore. But it was good, that's what I wanted. I wanted that boundary. I still had a piece. I've also had to learn how to deal with things emotionally. Let's do something that's healthy. Let's go running, let's play tennis. Stuff I couldn't do when I was 60 pounds heavier. I think when you lose weight, your confidence improves and your sense of self-esteem, when you realize it's not going to happen again, you're not going to gain it all back. And it has given me so much more confidence, because one, when you're not obsessed about your food or your weight, or how you think other people think about you, you can start investing yourself in relationships and trying things different and new. I think the biggest change for me, being a professional dieter and feeling like I was going to fail again, but at that point where I can't give up. I know as a nurse, I'm right around the corner from heart problems, from diabetes. My cholesterol was getting high. I had to figure out something that would work. And I think the biggest change for me really is hope. You know, it's not being obsessed with what I'm eating anymore. I just know that when I had the surgery, the day of surgery, I looked to my husband. I said, "This is the last day that I will be this weight," and it was the last day, and I know I will never be that weight again. And that's, you know, for someone who has tried since I was 9 years old, I'm getting there, and I know it's going to work.